it's happening in New York, New Jersey, or Long Island. Hear about it with Joe Piscopo. Mornings, 6 to 10 on AM 970. The Answer.
In the morning. Good morning, 7:45. Elena Frid is just one of the most intelligent young gals that I know. You're a neurologist, board-certified neurologist, clinical neurophysiologist, specializing in infection-induced autoimmune disorders. For a hypochondriac, for a father of 5 children, it's so great to keep you close, Elena. Thanks for getting up in the morning. I know you got patients waiting as we speak, so thank you for coming in.
Good morning. I'm happy to be here.
And we're running a little late, but you're great that you came in. You look good, and we're talking about everything. So you're going? Can we say you're going away for the holidays?
I'm going away for the holidays.
We'll miss you at the New Year's Eve bash then at our friend's house.
I'm gonna miss you guys.
Well, then I'm not going. If you're not going, you guys aren't going.
You're going. It's fabulous.
Yeah, I think I'm entertaining, actually. Hi, how are you? You know what I want to do? I want to bring like a kind of like a karaoke kind of thing, maybe. Wouldn't that be funny?
That would be good.
You know, because I'm always doing the entertaining. So the last time it kind of morphed into that, didn't it?
I know it did.
We started doing rock and roll tunes, and so maybe it's something to think about. But we'll miss you, and we're thinking about you. So, doctor, the flu shot. Can I start there? And then I got some other political things I want to ask you about if I can. I take the flu shot every October. I have to take the flu shot. I got it because I'm running around like a madman. It seems to work, and even with my intense schedule. But you're pretty much pro-vaccine, though, right?
So this is
controversial here.
This is a little bit controversial. The flu shot is recommended to, as you're getting it each October. The CDC is recommended it to everybody who's over 6 months of age every year.
That would be me.
Because the flu season is officially here. It's actually, the peak is from December to February, and sometimes it can even run into May. So I'd like to kind of talk about some misconceptions about the flu vaccine.
Yeah.
Because people may think that it protects you against the flu, which is not really the case. It can reduce your chance of having exposure, not exposure, but contracting the flu by about 40 to 60%, but doesn't really prevent you from getting it. Because every year we kind of make an educated guess, usually based on what's going on in Australia, as to what kind of strains of viruses we're going to have in the United States. And so we manufacture the vaccine to try to prevent kind of the more virulent viruses in it to prevent you from the bad ones. But it doesn't ultimately prevent you from the flu. Some things that you can do to prevent you from the flu is kind of common sense things, like washing your hands a lot, staying home if you're sick, and if you do have the flu, you should stay home for 24 hours after you've had the fever. So you should be fever-free before you're returning back to school or to work for 24 hours. Avoiding touching your eyes, nose, and mouth, because that's a sure thing of how to transmit a virus.
You know I'm a germaphobe. You're saying this you're teasing me now, aren't you?
Thing
I know you are.
That's kind of self-explanatory.
Here, I have disinfectant in my pocket, my Durasan right in my pocket. Yes, thank you.
Self-explanatory, but I think people are guilty of doing that, is once you blow into a tissue, you actually keep it on your desk. But you should really toss that.
Why do they do that? I saw an old guy. I was at the drugstore yesterday, and I just picking up some stuff, and an old guy, and then he's looking. I felt sorry for him. I look at him because he's probably my age, but he I don't say let himself get old, but maybe he's got something wrong with him. So but all I know is he reaches in his pocket, Elena, and he takes out the tissue, the handkerchief, into the nose, and then the tissue goes back in his pocket.
Not a good idea.
That's right. Am I right?
Yeah.
So kids get my kids do not get the flu shot. The mothers of my children do not want to give the mist, the nasal mist. Is it good? Is it a good idea to give or not give your kids a flu shot?
So it's actually really up to the parents, and then ultimately the recommendation of the healthcare providers. Why do some people choose not to have the flu vaccine?
Yeah.
Is that they can sometimes experience a milder version of the flu and can have fevers and chills and a cough after getting a vaccine. It's not that common, but it can certainly happen. And obviously, because like we talked about, it doesn't really prevent you from the flu, so people kind of take a chance. Some people that I would maybe be wary of getting the flu vaccine are people whose immune system may be suppressed, which is very young children, which is people who have chronic illnesses potentially, or somebody obviously who, elderly people sometimes may have a hard time with tolerating the vaccines. And ultimately, I would leave it up to your healthcare provider kind of what's the best recommendation for you, but adverse reactions from vaccines can happen in those patient populations.
Oh, and Elena, we appreciate you coming in. I got to ask you about CVS apparently buying Aetna for $69 billion. Is that deal likely to go through, do you think?
Joe, that was a very smooth transition.
Thank you. It was. This is
from flu to $69 billion and complete change in our healthcare.
Well, is that scare? Does that scare you though a little bit? When CVS, the drug companies, are going to buy now the insurance companies. I mean, it's a little scary, no? I mean, as a doctor.
I have actually a lot of questions that I don't know if will be answered unless this deal goes through and it's kind of too late to change things. But I am apprehensive about what's going on. I'm not sure they've blocked the deal a couple of years ago. I think maybe 10 years ago. That was that big. Actually, it was less big. I think it was 21 billion.
I can tell it bothers you a little bit, doesn't it?
It does. It does definitely bother me because a couple of decades ago, physicians went from MDs to healthcare providers, and right now this deal would make our patients go from patients to consumers. And I don't know how a CVS pharmacy, what responsibility does a CVS pharmacy have to a consumer compared to what responsibility does a physician have toward a patient. I don't think it's the same equivalent.
Yeah. So
there may be some positive things that would come out of it, potentially reducing drug prices that have been out of control. So if that happens, that would be great. But I am worried about kind of the type of healthcare, the quality of healthcare we will be providing to our patients.
Yeah, well said. Elena, where can we find you again? Elena Frid, ELENA, Frid, FRID.
MD.com. That's my website, and my phone number is 212-288-8832. And I'm also on Instagram and Facebook trying to keep up with Joe.
Oh, I'm going to have to follow you now, girl. You're on Instagram too? I am there. And the clothes, a quick plug for your clothes. I love this.
Oh, yes. So I created Dr. Frid Kidswear, which is found on Amazon, and it prevents you against insect bites. So this holiday season, when you're in the Caribbean, pick it up.
That's great. Elena, thank you for taking the time.
Thanks so much.
You're a star kid, and I really appreciate you being with us.
Thank you
Love
so
to
much
the family.
for having me.
Love to the boys.
Everybody knows this guy. Now, everybody knows he can do a radio show. Joe Piscopo. Mornings, 6 to 10 on AM 970. The Answer.